after pregnancy coverage, and family planning only. Topics include family planning only, after pregnancy coverage, APC, eligibility, covered services, scenarios, program impacts, outreach, and resources. Family planning only. What is family planning only? Family planning only, or FPO, provides coverage to individuals for family planning services to help them take charge of their lives and prevent unintended pregnancies. FPO can be for individuals who either make an informed choice not to apply for full Apple Health Medicaid coverage or do not meet eligibility requirements for full Apple Health programs. You have the option to seek confidential family planning services when applying for family planning only coverage if you are 26 years or younger or a victim of domestic violence. You can choose to have a preferred mailing address. You don't have to have an explanation of benefits or EOB mailed to you, and you can be routed to a live person instead of an automated system when you call in. Family planning only. Family planning only coverage helps prevent unintended pregnancies, including counseling, education, and/or risk reduction, education and supplies for Food and Drug Administration or FDA-approved contraceptives, natural family planning and/or abstinence, permanent methods such as tubal ligations or tubes tied, hysteroscopic, sterilization or vasectomy, sexually transmitted infection screening, testing, and treatment, and when appropriate, pregnancy testing and cervical cancer screening. Over-the-counter birth control without prescriptions or clinic visit with no cost to the client. For more information about covered services, visit the Family Planning Only webpage. You can also view the Apple Health over-the-counter birth control fact sheet. When would family planning only matter? It matters if you're an undocumented and the Apple Health expansion program cap has been met and you need something to cover the cost of your health exam and birth control. It matters if you have private insurance through your spouse's employer, but you don't want your spouse to know that you are on birth control. It matters when you give birth within the last year and your after pregnancy coverage is going to end, and you need coverage for family planning until you can get back on your employer's plan. It matters if you make too much to qualify for Apple Health, but you don't have insurance. And it matters if you're 16 and you need an STI test and you want that to be confidential, but you are on your parents' insurance. Family planning only updates in 2025. Healthcare Authority received approval from Centers for Medicare and Medicaid Services, or CMS, for the Family Planning Only 1115 waiver. The 5-year renewal applies starting May 1st, 2025 through July 1st of 2030. With the waiver approval, Healthcare Authority was able to increase the age of confidentiality for clients from age 18 to age 26. The age increase was approved by CMS with an effective date of May 1st, 2025. Healthcare Authority is currently in the process to update the family planning only application to reflect the age change for confidentiality. Income guidelines. To qualify, income must be at or below the income standard of 265% of the federal poverty level or FPL. This includes a 5% income disregard. An example of that would be a two-person household can qualify when they earn up to $4,672 a month. The income standard listed in these examples are subject to change annually every April. How to apply. There are several ways that you can apply for family planning only. You can apply via fax at 1-866-841-2267, or you can email apple@hca.wa.gov. You can call 1-800-562-3022, extension 12533. Translation services are available, or you can mail your application at HCA Meds, P.O. Box 45531, Olympia, Washington 98504. Family planning only has a 12-month certification period. You will need to reapply for the program each time your certification period ends to continue your coverage. To receive family planning only materials at no cost, email familyplanning@hca.wa.gov. Be sure to include the publication number, how many you need, which languages, and a mailing address. After pregnancy coverage. Background. Prior to the expansion of postpartum coverage, pregnant people on Apple Health Medicaid received 60 days postpartum coverage that began the following month after a pregnancy ended. After 60 days of coverage, individuals had the option to recertify their coverage for another Apple Health program, and if not eligible, or if no action was taken by the individual, the postpartum coverage would automatically transition to 10 months of family planning only. Family planning only is a limited benefit package that covers contraceptive care and family planning related services only. American Rescue Plan Act. In March of 2021, the American Rescue Plan Act, or ARPA, was passed, allowing states the option to extend postpartum coverage to 12 months beginning April of 2022. The scope of services and benefits are the same and not less in amount, duration, or scope. The 12-month postpartum extension is available to individuals who received Medicaid services during their pregnancy period. The extension begins the month following the last day of the individual's pregnancy. Substitute Senate Bill 5068. During the same year ARPA was passed, Washington State passed Substitute Senate Bill 5068. This mandated the extension of postpartum coverage from 60 days to 12 months after the end of a pregnancy. This bill also allowed individuals to apply for and receive postpartum coverage throughout the 12-month period after the end of their last pregnancy, The postpartum extension program is named After Pregnancy Coverage, or APC. In March of 2024, Substitute Senate Bill 5580 was then passed, and this allowed up to 5 additional days of hospitalization stay for the birth parent, and it increased the federal poverty level income limit from 193% to 210% of the federal poverty level for all Apple Health Medicaid pregnancy and after pregnancy coverage programs effective November 1st, 2024. The result. The result of these changes is that individuals who are on an Apple Health program and report they are pregnant will automatically transition to after pregnancy coverage for 12 months after the end of their pregnancy. Individuals who are not on Apple Health during their pregnancy may still apply for after pregnancy coverage within 12 months of their last pregnancy ending. Both the pregnancy and after pregnancy coverage programs have an increased income limit of 210% of the federal poverty level as of November 1st, 2024. Eligibility. Active on Apple Health. Individuals who are active on an Apple Health program and report they are pregnant will automatically transition to the postpartum extension. For this automatic transition, a pregnancy must be reported as well as a pregnancy end date to guarantee the postpartum extension after pregnancy coverage. After pregnancy coverage will begin the first day of the following month the pregnancy ends, regardless of any pregnancy outcome, and coverage is continuous for 12 months, regardless of a change in income or household size. Learn more by visiting hca.wa.gov/APC. New to Apple Health, individuals who are not on an Apple Health program may now apply for after pregnancy coverage. To qualify, the individual has to have had a pregnancy end within 12 months, reside in Washington State, have countable income equal to or below 210% of the federal poverty level, and not be active in another Apple Health program. Immigration does not apply, and coverage begins the month the individual applies and is found eligible. Income guidelines. To qualify, income must be at or below the income standard of 210% of the federal poverty level, or FPL. There is a 5% income disregard included. An example of that would be a 2-person household cannot earn more than $3,790 a month to qualify for after pregnancy coverage. The income standards listed in these examples are subject to change annually every April. To apply or report a change. For those who are not currently on an Apple Health program and looking to apply for after pregnancy coverage, or for those who are active on an Apple Health program and need to report a change or pregnancy, they can do so by going online to wahealthplanfinder.org, or they can call 1-855-923-4633. They can submit a paper application or in person at no additional cost at a local health benefit exchange navigator who can help apply for coverage. Learn more at hca.wa.gov/apply or renew coverage. Covered services. Covered services. After pregnancy coverage is comprehensive coverage that mirrors the services received during the individual's pregnancy that include but are not limited to physical health visits such as primary care, specialty care, urgent care or emergency room visits, behavioral health services such as mental health or substance use disorder treatments, oral health, and hospital services, both inpatient and outpatient services. To learn more about covered services, visit our website after pregnancy coverage. Maternity support services. Maternity support services, or MSS, are preventive health and education services to help an individual have a healthy pregnancy and a healthy baby. Individuals can receive MSS through the First Steps program if they are pregnant or up to 60 days postpartum and receiving Apple Health and offered in addition to medical and prenatal care. Services may include pregnancy and parenting information, screening for possible pregnancy risk factors, and a referral to community resources. Infant case management. Infant case management, or ICM, helps parents access medical, social, educational, and environmental services to improve the health and well-being of their infants. It promotes a supportive network for families through referrals and connections in the community. Services can be provided virtually in the provider's office, in the family's home, or in a community setting. You can find ICM providers listed by county on the First Steps provider directory or call Within Reach at 1-800-322-2588. Childbirth education. Eligible pregnant individuals and their support persons can attend group childbirth education or CBE classes at no cost when the classes are taught by a healthcare authority approved CBE educator who accepts Apple Health. CBE usually starts during the third trimester of pregnancy, and topics may include, but are not limited to, newborn care and changes to expect at home after the baby is born, safe sleeping position, car seat safety, and well childcare. For more information about MSS, maternity support services, ICM, infant case management, and CBE childbirth education, visit the First Steps Enhances Services webpage. Scenarios. Scenario number 1. Active on Apple Health. Maria is a 32-year-old U.S. citizen with income at 130% of the federal poverty level. Maria is 3 months pregnant, and on May 2025 they apply for and are eligible for the Apple Health for Pregnancy program. Pregnancy ends November 30th, 2025. After pregnancy coverage or APC is then automatically approved beginning December 1st, 2025 and ends November 30th, 2026. Scenario number 2, not active on Apple Health. Ava's pregnancy ended May 15, 2025. Ava was not active on Apple Health during the time they were pregnant. In June, Ava applies for postpartum coverage and has income of 180% of the federal poverty level. After pregnancy coverage starts on the first day of the application month, and the certification period is a total of 12 months beginning June 1st when Ava applied and was approved, and will go through May 31st, 2026. Scenario number 3, active on Apple Health. Sydney is a pregnant, non-qualified individual and enrolled in Apple Health for pregnant individuals on June 1st of 2025. Sydney has reported an estimated due date of December 15th, 2025. Because after pregnancy coverage starts the month after Sydney's pregnancy has ended, the certification period for Sydney's after pregnancy coverage will begin January 1st, 2026 and will end December 31st, 2026. Scenario number 4, not active on Apple Health. Jennifer is a non-citizen who applies for Apple Health in November of 2025. Jennifer answers yes to having had a pregnancy end in July of 2025 and attested to having income of 194% of the federal poverty level. As of November 1st, 2024, the pregnancy and after pregnancy income limit increased from 193% to 210% of the federal poverty level. Jennifer qualifies for after pregnancy coverage because they had a pregnancy end within 12 months and their income reported is under 210% of the federal poverty level. Jennifer's certification period will begin November 1st, 2025 and will end July 31st, 2026. After pregnancy coverage will be approved for 9 months of continuous eligibility only since Jennifer's pregnancy end date was July of 2025. Program impacts. Impacts of after pregnancy coverage. The Healthcare Authority is working to identify opportunities for improvement due to the low utilization of after pregnancy coverage. We are evaluating how are people being enrolled into after pregnancy coverage, what services are being accessed in year post end of pregnancy, and if there are any costs. While we know utilization is lower than anticipated, the outreach efforts continue to educate and promote the Apple Health pregnancy and after pregnancy programs and services that are available for them. Opportunities for improvement. The Healthcare Authority has identified areas of improvement to include a request for a wide partnership amongst all that work with or support pregnant individuals. Providers and care teams can encourage clients to report their estimated due date and/or end of pregnancy date to ensure a seamless transition to after pregnancy coverage. Providers and care teams who have direct contact with clients can also assist in informing new mothers or those who have had a pregnancy end in the last 12 months of available services and how to access them. This also allows a warm handoff to a primary care provider when clients are discharged from pregnancy care. Outreach. Outreach efforts. When after pregnancy coverage was implemented in June of 2022, Healthcare Authority completed outreach to intended audiences through social media, radio, community-based outreach, and publications. These efforts continue today to educate citizens across Washington state on after pregnancy coverage and the new poverty level of 210% for all Apple Health pregnancy-related programs. Webpage. You can learn more by visiting the webpage at hca.wa.gov/APC. APC Flyer. The After Pregnancy Flyer can be found online under Form 19-0076 and is available in 15 languages. A poster is also available online under HCA Form 19-0077 and is also available in 15 languages. The poster also includes a QR code that directs clients to the After Pregnancy Coverage webpage for more information. Resources. GovDelivery. Stay connected with general information and updates on Apple Health programs or by choosing your topic of choice and future webinars by subscribing to GovDelivery at the website listed on this slide. Follow us on social media. Listed here are our several social media platforms, and we now have Blue Sky. For more information on family planning only, go to hca.wa.gov/family-planning-only. For more information on after pregnancy coverage, go to hca.wa.gov/APC. For more information on pregnant individuals' eligibility, go to hca.wa.gov/apple-health-pregnant-individuals. And for our training and education webpage, go to hca.wa.gov/stakeholder-training. For questions on Apple Health eligibility policy, you can reach the Apple Health eligibility policy team at hcaah@apple.gov. eligibility policy at hca.wa.gov. Thank you for listening.